Hey everybody, how are you today? This is Jim Prusak, physical therapist here at the Pain PT, and we're going to talk today about looking for your cause of your symptoms, cause of your issue or your problem or your somatic complaint. And this is really the most important thing is to look at your history. And this is something I do with all my patients on the first visit because I want to clarify and identify what is the underlying cause of the problem. And I'm always talking to you guys about taking your awareness or your focus off of your physical symptoms because that's just the output. That's not the cause. The symptoms are not the cause. So we need to go back and look and see, well, what caused these symptoms in the first place? Was it a physical stress or injury? Or was it more a mental and emotional stress and injury that way? Now remember, all three of those things can cause the very same physical somatic symptoms in your body: mental, emotional, and physical. Now, what I'm looking for with people are a couple of things. If there was a physical injury or physical stress that caused the problem in the first place, I want to see how long has it been since that happened. Now, we know the body has a healing time frame for all injuries, and as a physical therapist, treating physical injuries are really quite easy because the body does heal in time. So if you have a sprain, a strain, a broken bone, even post surgery, the body has a timeline where you're going to heal, and we can say, look, you'll be back to doing XYZ in 4 to 6 weeks, or maybe 3 months, post surgical, 6 months even sometimes. But the longer you go out from a physical injury problem, the less likely it is for the problem to be physical anymore because the injury would have healed. The only times that typically you might see physical causes still that are going on for a long period of time is if there's a very severe degenerative change in the tissue. Um, let's say a hip joint that really has severe degeneration, the patient might need a hip replacement or something like that. But otherwise, the body heals. That's what it does, and pain typically goes away as the body heals. Now, a lot of people I talk to and a lot of people I see never even had a physical injury or stress to begin with. So when we look at their history and when their condition started, and we go back in time, and I asked them, well, what was going on around the time that your pain or your somatic symptoms started? Did anything physically happen to you? Did you get into a car accident? Did you have a traumatic injury, a fall? Something that would indicate something physical. Most people say, no, I didn't. Okay, well, what was going on in your life around that time? Was there additional mental, emotional stress at that time in your life? And almost everybody has something that's been going on or multiple things going on at that time that you can point to that say, yep, that was more likely to be the cause than something physical. Now remember, doctors, modern medicine is not asking these questions. They don't believe that stress can cause physical symptoms. They know that stress can make physical symptoms worse, but a lot of times they're not screening for a mental emotional cause for a physical problem. But we need to do that. Like, I hear story after story of people with different types of stress, emotional stress, mental stress from things going on, things that have happened to them, that their physical symptoms started around that time. So that would be a cause. Okay, so if we can identify a mental emotional cause to your problem, and we know that also the problem has been going on for longer than a normal time frame to heal, then this is what's called TMS, tension myositis syndrome, mind body syndrome, neural circuit pain, neuroplastic pain. We have all these different names for the same thing, but essentially the problem is more in the nervous system and brain. It's not in the local tissue like a joint or a muscle or a ligament. So, what is the answer then? So, we want to, if the cause is mental emotional, we want to focus our attention on that as our treatment. We don't want to be focusing on the physical. And this is why a detailed history is really, really important on the front end to determine, well, what's happening here? What is the cause? If it's structural and physical, well, that type of treatment should help you get better. We need to send you off to see a doctor or get medical treatment. If it's not, then we can move towards this mental and emotional realm that I talk a lot about here at the Pain PT and start to identify and look at emotions and look at stresses that were going on around the time this pain started, maybe earlier in life too, where it set up your nervous system or brain to be hypersensitive and sort of at risk for a chronic condition. And then we also want to look at, since the pain or symptoms started now and how long it's been going on, is how are you processing this pain or somatic complaint? How are you dealing with it mentally? Are you catastrophizing, worrying, ruminating, hypervigilance? We want to look at all these categories of mental and emotional stress, and we want to move away from anything physical. If the cause is not physical, the treatment should not be physical. That makes perfect sense. Yet somehow our medical world believes every condition has to be physical. Every pain has to be physical in cause. And it just doesn't make sense logically. I get a lot of people that say, yeah, I woke up in pain. Oh, it just started one day. It just doesn't make sense. I hear lots and lots of stories. Let me give you one example of a lady who had been walking and doing a lot of exercise and moving and no problems at all. And then once COVID hit and her life had changed because she couldn't see her grandchildren, couldn't see her family as much, and she was in her home, and then her husband had recently got a diagnosis of bladder cancer. Well, she developed some back pain soon after that. And when I asked her history, I said, did anything happen to you physically? Did you have any change in your physical routine, your exercise? Did you bump it up? Were you doing more? No, nothing like that. Now, to complicate the matter, she, after that, got an MRI report done on her low back, and it showed severe degeneration L5S1. Now, if I didn't have her history, you could easily point to that degeneration of her back as the cause. Now, as we know, that degeneration did not just happen overnight. It was not something that just started in the last, 6 months or something like that. That would be an ongoing change over a lifetime, especially with no physical injury. So we can't hang our hat on that because that degeneration was probably already there. We need to go deeper and look at her history. Now, because of the additional stress that was put on her, what happens is, and we've talked a lot about this here at the Pain PT, is that goes through your nervous system and starts to create changes in your body. One of them being muscle tension, guarding, and tightness and protection. Now, if you can imagine your muscles tightening up, what that does to your joints, it puts a little bit of squeezing on them. It puts some compression. Now, that could cause pain. So the issue, even though there's degeneration, it's more likely to come from muscle tension, which is caused by the brain and nervous system from mental emotional stress. So that's just one example of a case that we can look at where there were physical changes, and we have to go back and look at the history because we cannot just rely upon imaging reports because they're just very static. They don't mean much by themselves. And we also know the research shows a lot of people have all sorts of changes in their body and they have no pain. So it doesn't make sense. And then if you just think about aging, I work with a lot of elderly people as well in regular physical therapy. And, all of them have massive changes in the body, massive joint changes, massive changes in muscle mass, but not all of them have pain at all. So it doesn't really add up. If it was physical in nature, then everybody's pain level would just be continued to rise as they got older. So we know that's not true. So I just want to point you guys back to looking at the cause of your problems, your physical complaints. Go back to the cause, see if it was physical or see if it was mental and emotional. And then you have, from that point, you have a roadmap going forward to where you should focus your attention. All right, everybody. Hope this was helpful. I'll talk to you guys next time. Bye bye.